Thank you so much, Professor Shamika Ravi. Thank you for joining the New Indian Express. We've been following all your analysis on COVID-19, the spike of the number of cases, or how India is coping with COVID-19 specifically. So I would like to begin with asking you, where do we stand as a country, given our population, given our economy? You've suggested that if not for the lockdown, as on April 18th, the number of cases could have been about 1,254% higher. So if you can start off telling us how we are dealing with COVID-19 in India.
Well, I think to bring in an objectivity in this whole COVID crisis, it's important to first look at the fact that while the first cases of COVID were reported from Europe, US around the same time, which was the last week of January, we were quite proactive, thankfully, in terms of airlifting students, keeping them in quarantine. A lot of screening started at the airport, and notwithstanding some high-profile cases, and I'm sure there might have been scores of people who also jumped quarantine. But on the whole, a lot of these big measures were taken early on, because of which, if you see the early growth rate, that got bucked right in the beginning. So we were growing, at a rate where we were doubling every 3 days, and then that slowed down, which means we went to doubling every 5 days. But then this big lockdown has happened, which truly is, it's very large, it's very drastic. If you consider 1.38 billion people curtailed, locked in their own homes, and yet it's important to realize that for a resource-poor country like India, this becomes a preemptive, necessary step to take. That even if we went by the statistics, globally, and we knew that only 5% of cases would require hospitalization in acute situation with ventilators, etc., we don't have that kind of infrastructure. So I think to be early on, this lockdown absolutely required. And as you can see, 2 weeks after the lockdown, which is the nature of this virus because it has an incubation period of about 2 weeks, from the 6th of April, there is a very perceptible decline in the growth rate. Important to remember that we are still in the growth phase, meaning total numbers will accumulate. It will continue to grow for some time, but the rate at which we are growing, that has been slowed tremendously. And that is what the flattening of the curve, which basically tells you that we bought time. We've bought considerable time. And what we do with that time now remains to be seen. A lot of action is happening in the States. But clearly, the growth rate has now fallen to about 11 days doubling. But of course, remember the base is very large too. Right?
That's
so you have.
You mentioned about how growth rate has reduced, but we are still in the growth phase. That brings me to the question of spurt in the number of cases that we have seen across the states over the last 5 days. Let's say, for example, take Karnataka, for example. I report out of Karnataka. So I have seen a drastic spurt in the number of cases over the last week. So is that a matter of concern too, before we understand that we are already flattening the curve or moving towards flattening the curve?
Well, since you talk about Karnataka, I've just pulled out some numbers for the 5-day moving average. Anush, it's very important to remember that, the day-to-day fluctuations will happen. We'll have to begin to read some trends into it, right? Because that's the only way to understand which way we are headed. Now, much unlike the initial epi models which project, right? They tell you 400 million people will get infected and 600 and so on. Those are based on parameter estimates which are from other countries. Okay, they're not estimated from Indian population. So it's not surprising now that a lot of those models now, are discredited in the sense they have to be updated, right? They have to now take into account a lot of the Indian circumstances to make sense. But so that's why we started following just the stats itself. I said, forget about projection because it's so complicated with so little data. Let's just follow the data, which is verifiable and credible data. Right. So we started looking at the Johns Hopkins data. And more recently, we have also started looking at the COVID-19, the crowdsourced data.
Yes.
And that gives us some state level estimates, right? So moving averages for Karnataka, for instance, because you're from there, you're interested. Karnataka, it's true that while the trend is upwards, lately there has been a mild decline, all very welcome. But the numbers still are within manageable limits, Anusha,
Right.
okay?
Right.
The highest episode that happened was just a little over 40.
Yes.
Okay, on one given day. So we are talking now to bring some, again, a larger perspective on things. The All India numbers are largely getting driven by what's happening in Maharashtra, Delhi, and of late, you've had enormous escalation in Gujarat. Okay, now it's almost growing exponentially. And I think that's where it's important to realize that we are seeing now the outcomes of actions we have taken 2 weeks back, which
Right.
means
Right.
a week or two into the lockdown period itself. Okay.
Right.
Now, clearly, the confinement strategy is not working in Maharashtra. And by Maharashtra, I mean the hotspot is really Bombay.
Yes.
Right? So it's, and by same token, Gujarat. So if there are these escalations happening in the middle of the lockdown, it's important to now start understanding what aspect of this confinement and the lockdown is not being enforced, not being, right? Because so far what we have been doing is we've been appealing to people to maintain social distancing. Of course, many states, the nation as a whole has also invoked the Epidemic and Disease Act, which means that there are restrictions on movement. The state has certain extra powers to detain people and so on. It's important to remember that an epidemic like this, you don't just cause harm to yourself. There are considerable negative externalities for people around you, right? And that's why this whole contact tracing, the surveillance, all of that becomes very important. Testing is one part of it.
Right.
But the way to contain the crisis requires a lot of, requires many people besides just the kits and the hospitals. That's the way people typically look at it.
Also,
but one has to
cooperation from
understand
the public.
Cooperation from the public. But what I'm saying is that when there isn't public also there is, it is also being enforced properly. Right? So it is as much an establishment story as of people, not sort of sticking to the guidelines. And I think that is where it's very critical to realize that local administration has to therefore now focus, and I'm talking local because it can only be done by local administration.
Right.
We are not even speaking states right now because the hotspots are defined by districts. You really have about 170 hotspot districts in the country. So we are saying that what is the local administration they're doing if the lockdown or the confinement or the containment is not perfect, right? If there are leakages which is leading to greater, what aspect of this contact tracing are these local establishments missing out on? Right. Why are people jumping quarantine? Why is there this massive increase? And I think that's where we have to draw lessons from some of our own success stories. And not looking at Singapore or Japan, which, by the way, are seeing second waves and themselves are struggling. And that's why this is such an uncertain situation. And not just for us. In the Indian case, it becomes more acute because state capacity and resource poor. We just don't have that degree of resources and amenities. So it's important to be doubly smart about it. Right? We can learn something from the Kasaragod initiative by the Kasaragod police that happened over the last month or so. And it's important to look at exactly what are the steps that were enacted. Now, in beginning of April, you had very similar numbers, well, all under 200, okay, in northern Kerala, Kasaragod, and in Bombay. And today we are seeing the differences now in magnitudes, right? And now, of course, Bombay is different and it's bigger and more complicated, but it also has more resources. A lot of this has to do with planning, right? And I think it's important to realize that it is a health outbreak. Right. It is a public health concern, but a lot of it has to do with policing, right? Contact tracing is really about getting someone to debrief and ask you, well, where all have you been? Whom all have you come in touch with? Verifying that through call records, while also making your life easy by saying, look, we'll deliver food to you. And if required, we'll deliver help in the form of medical services, etc. So establishment is a very large part of the story.
Right.
Okay. And of course, people are the other half of the story. We have to stick by the guidelines.
Well, you spoke about how district authorities have a huge responsibility in containing measures. A challenge to the district authorities has also been concerns that have been raised about one, population density, of course, but social distancing being a luxury. So that's when the economic aspect of COVID-19 containment measures do come in. Uh, as you already highlighted, we are a resource. We are not a country that has a lot of resources. We need to manage with what we have. How do you address the concerns? Or how are the authorities addressing concerns of social distancing being a luxury for many?
Now, let me tell you, very early on, at least in places, again, Kasargod, because it's important to go beyond the national stats, which is what I'm frankly, I've been monitoring more closely. But I think lately we have also started to study some of the districts which have been doing exceptionally well in containing this outbreak. And a lot of the lessons are really on the ground in terms of the micro measures taken, etc. There they had a plan B as well. They have on the whole under 400 beds,
Right.
hospital beds in the whole of the district.
Right.
But the plan B required you to then first of all designate some places as COVID. Tell people that look, there are all these other hospitals which are non-COVID. So if you are a TB patient,
Right.
if you need dialysis, because there is something called all-cause mortality. People are not just getting infected and dying of COVID. In fact, it's a very small number given the overall context that there are so many non-communicable diseases and other kinds of health needs which are
Right.
adding to the problems.
Right.
Livelihood apart,
Yes.
right? So there is threat to life as well in the lockdown.
Yes.
Because health is more than COVID. So designating non-COVID or regular hospitals, making sure that the social distancing becomes relatively easy by acquiring a lot of hotel and smaller guest houses and rooms,
Right.
and making it available so the quarantine can effectively happen. Right now, that's of course the quarantining part of it, meaning when you know someone is likely to be infected or is infected. But the rest of it, it's a reality that social distancing, when 12 people are sleeping in a room, it is what it is.
Yes.
But again, I think, it is not a peculiarly Indian situation. Of course, for us, the magnitude is always very large. But you are seeing this in the numbers coming out of the US. You are seeing this in the numbers come out of Europe. It's usually the poorer segments of the society, of the lowest income groups, quintiles, which are most affected. And the probability, so the mortality rates also tend to be higher for, let's say, the Black population in the US is disproportionately higher. So yes, I mean, the narrative is very similar, and every society is perhaps trying to do its best.
The Ministry of Health and Family Welfare, as on Monday morning, put out the total number of COVID-19 cases at 17,265. This is their estimated morning. That also includes about 14,000 plus active cases. Now, when we are looking at these numbers, are you convinced that we are testing enough? Are the spike in the number of cases a result of more testing, or like you said, the outcome of a lockdown period where, thanks to restriction on movement, cases in identified clusters are being thrown up? And are they taking us by surprise? I ask this question because in Karnataka, the officials tell us that the cases that are being thrown up right now are from identified clusters. They are not being taken by surprise by new geographical locations throwing up cases.
So, Anusha, first of all, there's nothing called enough testing.
Right.
You have to continue testing.
Right.
Simply because testing, with all its false negatives and false positive, is still knowledge.
Right.
It's still information, right? Whether there is community spread, whether new districts, new blocks are indeed going to throw up cases, there's no way to tell that without testing.
Yeah.
And then repeat testing, frankly. There is something called testing of samples, and there's testing of individuals. Individuals also need to be continuously tested. But again, remember that constraint is a real one, I believe, that, just not having enough resources. And here again, it's not necessarily just the kits, right? You need to have, for the samples to be transported in real time, You need to have the refrigeration facility, the entire supply chain, no logistics. You need HR, you need individuals beyond the kids who can do these things. So, a chain is as strong as the weakest link. And right now, I think it's not necessarily the kids alone, which are proving to be the constraint. It's many other factors, right? That's number one. Number two, the testing has been ramped up considerably.
Right.
It still needs to be, but our numbers have shot up a lot since the 27th of March, and it is showing a continued increase, and that's a good thing. With that increase, we are seeing slight increase in terms of the positive cases per 100 tests.
Right.
Right now, it stands, it's hovering around 4%.
Yeah.
Okay, so that we have seen it might increase a little bit, but 4% is still very low compared to what you saw in the US was close to 20%.
Right.
In Italy, it was about 24%, right? So we are saying that even with a very conservative testing protocol, where you are basically testing people with symptoms or who have had travel history or who have been in contact. So these are all relatively conservative, right? You haven't randomly gone out and tested people in the population.
Right.
So despite a conservative protocol, the numbers are still much lower than what you have seen in other countries. So there's reason to believe, therefore, that perhaps, in the Indian case, the situation is not so bad, right? The second way to look at it is the hospital data itself. And we have looked at some hospital data, and we are seeing in terms of number of cases coming with acute respiratory ailments, which could be a symptom for COVID. COVID happens to be one, which is also respiratory. But the trend this year looks very similar to last year and the year before that. So there is no great rush happening. There might be isolated cases, right? I mean, 1.38 billion people, everything is possible. But systematically, we are not seeing great rush in the hospital, as the hospital data are showing. But regardless of that, testing is the only way to confirm whether the cases are indeed happening. Now, that's why it's important to look at the total cases and break them up into active cases, recoveries, and then deaths. Right? So recoveries also, it's rising in India, which is all good because it means that care is being provided. Could be that the strand of the virus itself is perhaps not as virulent as it is in some of the other countries. It could also mean that, the statistics which everyone cites, where 5% of cases will require intensive care, ventilators, etc. Again, that's not based on Indian data. It's based on the OECD countries. That's the JAMA paper. So right now we are really, trying to make sense of the data that we have. And believe me, we have little data.
That is very unfortunate. Now, I have to ask you the economic fallout of the lockdown. You've spoken about how because of the lockdown, there has been restriction of movement, and probably that's bringing in some good news for India as far as containing COVID-19 is concerned. But the economic fallout of the lockdown, how intensive is it, and how long will it take for us to bounce back to normal, or should we presume that this is the new normal and we have to start from scratch?
So I've often heard people say that, it's not going to be, it's not just switching on and off and you can go back to normal. It's really a resetting of the entire, the way relationships are structured.
Right.
And I suspect it's also the way production is set up in a society. There might be greater automation. There's a lot of right now churn happening even within the business community in terms of reorganizing, in terms of trying to understand which way their individual industries are going to move. Of course, with the economy in a complete standstill, it's important to realize, first of all, that we are in a recession.
Right.
It's important to now also realize that for an economy of $2,000 per annum per capita GDP, we are a low middle income country.
Right.
To not generate wealth also means very many people are going to fall below poverty line. Right? Of course, there is state support. There is likely to be greater state support. The economic packages, the monetary policy, all of them will hopefully lead to a percolation at the firm and the household level where the total impact, economic impact of COVID will be assuaged. So there'll be some softening of that. So the landing will hopefully be soft. But the economy as a whole cannot afford to be in a shutdown for a very long period of time. And I think that is where the testing becomes strategically of great importance. If we are saying that 325 districts are untouched by COVID, we should open them up.
Right.
Because the longer you stay locked in, the more we are eating into our savings. Okay, and that holds for the society, the GDP as a whole.
Right.
So you're creating less wealth. It's really a matter of redistributing and making things, the soft landing, so to say. But we're not creating wealth. The longer we stay, it means it's not just creation, we are effectively shrinking the pie. That's a depression. We have to prevent that from happening. That is where this calibrated move in the form that geographically, let's open up sectors. The hotspots are not even at district level. They're really at block levels. So let's try and isolate them, contain it, and as soon as possible, let's go back to wealth creation and just life. But for firms, I think it's important that they also will need to step up now. Their cost of production will rise. And it's not just in terms of uncertainty and risk, but also they have to put in place mechanisms of screening, of providing adequate masks, protective equipments, making sure the shop floor there is social distancing. Because, until the entire country is COVID-free,
right,
which right now no country is, right? Because even China, Shanghai has seen perhaps a second wave. Singapore has gone back to a national lockdown. After weeks of apparent success, Japan has now declared a national emergency.
Right.
So we are talking either herd immunity,
yes,
or there's a vaccine. Other than these two options, we are just going to see continued uncertainty and costs mounting, right? So it's important to therefore think this the way you are thinking as an individual in the household and washing your hands and wearing your masks, etc. We have to make it possible for economic activity to happen with all these protective and preemptive measures. So the costs will go up. Some sectors, however, it's not just a matter of cost.
Right.
The demand has shrunk and is likely to decline for a very long period of time, right? Travel, think of hotels. There are some, areas and sectors which will see a prolonged, cost
decline.
And a shutdown. Absolutely decline. So the demand decline is a very large part of the story as well. Think of exports. I mean, apparel is a sector which is very labor intensive. It's an export-oriented sector. It's a sector where we have been trying to encourage and compete with the Bangladesh and the Vietnams and so on. And yet, one can't imagine if you look at the demand elasticity, even if the OECD markets bounce back, suppose Germany bounces back and US and UK and etc., elasticity of demand means that the demand for apparels and footwear and luxuries and many of these things are relatively non-essential. So they will take longer to pick up.
Right.
Okay. So exports are also going to be hampered.
Yes.
For many sectors where strategically we have an interest in the global economy. So yeah, there are many sectors that are going to deal with increased uncertainty for a long period of time.
Before I let you go, I must ask you, this is an unprecedented situation, whether we are talking health-wise, economy-wise, psychological health of individuals are also a concern, the prolonged periods of lockdown. What do you hope will be the outcome of it all? Not just the problems of lockdown, but what do you hope for countries to learn, for economies to learn, more investment in the health sector, more priority for research, etc. What do you hope is the lesson we learn from this before I let you go?
So, every crisis is also a great opportunity. And I think in the Indian case, it definitely has opened a window of opportunity for us. I think the recognition that health sector is not a social sector. It's very much a strategic sector. Self-reliance is very important when it comes to healthcare. That's number one. Number two, with the global economy aging, if you look at the OECD countries, they're aging. And the demand for healthcare only goes up in every country, right? health sector has almost not, I mean, it doesn't shrink with growth anywhere. So with global economy growing and aging simultaneously, I think demand for healthcare is only going to rise. And I think strategically for us, then it becomes the strategic sector, the engine of growth over the next 50 years, which means India has to view this crisis as a window of opportunity to really think of a healthcare focused investment strategy for future growth. Okay, and that requires HR, doubling the number of doctors,
Yes.
Making doctors, I mean, not beating up doctors. We have to, right, think of
Yes.
pharmaceutically, we are the pharmacy to the world as far as generic drugs are concerned. Perhaps a little less reliance on China might be good. Increasing, even within the generic sector, just increasing our share in the global trade. The pharma sector, again, I think I'm very bullish on it. I think India has a great scope to become a world leader. Of course, we have to invest in R&D.
Yes.
And that, I think, in many ways does prove to be the Achilles heel as far as the economy and policy making is concerned. So the second would also be research. I think it's high time that we invest as a country, not just from the government to a large extent, but also private sector. To function in uncertainty is not a good thing. And I think it's the countries that are investing more in knowledge, which is R&D, either to develop products and services from the private sector or policy making in the case of government. Societies which know more are in a position to deal with this crisis are far better.
Right.
Of course, it is not just about health crisis. I think any crisis, knowledge is truly something you have to invest in. So I think moving forward, we should see an increase in our spending, both in public and private, in terms of research and development.
Thank you. Thank you so much for your time, Professor Shamika Ravi. You gave us a lot of insight. It's definitely good to know that we are in the process of flattening the curve, that we have a lot of good news when compared to other countries. Aim is, of course, to reach 0 cases. But for now, to just have the assurance that we are better off than most countries, I think is good for all of us Indians. Thank you so much for joining the New Indian Express.
You're welcome. Namaste.